Hello, my humble pleasure to come your way again. In this edition, we may put special edition of You and Your Health. In today's edition, we're going to unveil, what they call behind the scene. Most time people, films are being made, and after the film is being made, people watch the film, the emotional, how wonderful. But that's what is called behind the scene. The ones that are not shown to the people. And that's why today we're going to look at a major crisis which has been like an European and American kind of experience, but now is also creeping into our society, and that has to do with the mental health crisis. A lot of people are suffering depression, emotional instability. A lot of people can be said to have a serious psychiatric problem as I'm talking to you now. And that's one of the key things we're going to talk about. Your mental status, its effect on your overall well-being, on your own health. And today is going to be so explosive. You know what? I will reveal to you today the latest divorce strategy. Every married woman should listen today and get this secret. A lot is happening in our society. Many women are breaking down. A lot of people are having suicide tendencies, and some have already committed suicide. Of course, you remember a young girl that alighted from a car and only to jump into the Third Mainland Bridge. What went wrong? That's what we are going to discuss today. I want you to invite everyone you know. Everyone you know. I'm telling you, many people are shedding tears. Their health is going down. And I will tell you something. One thing they will get today can bring them back to that person you used to know them for. Do that right now. I'll be right back.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health. I remain your friend, Dr. Richard Okoye. And today's edition is something we're going to look into critically, and that has to do with the mental crisis in our society, which also reflects to the overall state of your well-being. I got a little bit worried on what is happening in our society today. People are flying out. They call it Japa. Flee. Make a run. My friend, I will tell you where you are running to and the implication of where you are running to today. So that when you have a balanced insight into where you are going, it helps you to manage crisis, manage challenges, because life has never been without one. Be it in Nigeria, United States, Europe, everywhere, you have their own peculiar challenge, which you have to be mentally balanced to be able to manage. And that's why I say today edition, I will share with us the latest divorce strategy. Every man, every woman, every married woman, and concerning your children, you need to know so as to be able to protect them on what could be an emotional disaster. Now, first of all, we look at this very subject of mental health. If you look at mental health and also a lot of psychotherapy and all the psychos and psycho things associated with it, people get confused. What is mental? Because whenever you people talk about mental health, you look as if na madness. That's why in this side of the world, when you tell a patient, you need to see a psychiatrist. You say, are you saying that I'm mad? What do you mean that I need to see a psychiatry? No. We are going to settle something today. That a psychiatry does not mean madness. No. There's a difference between schizophrenia. Schizophrenia is that one you say the person don't colo. Okay? And also a psychiatric problem that is also ranged from the state of anxiety, depression, some of these emotional crises, suicide tendencies. They are all within within the context of mental state of a man. And that's why when you are looking at mental health in ideal definition, you look at it from the dimension of achieving an equilibrium in the aspect of your physical, emotional, psychological, and also spiritual well-being. There's an equilibrium, there is a balance. Whenever any of these tilt to one side, you suffer mental crisis. And so when you are looking at it, you are looking at it as a whole life subject. A whole life subject, and you need to be mentally stable for this your body also to be healthy. Because in any way anyone goes wrong, something will definitely, in an ugly sense, hit this your body. You get me? So now we look at it is that let's look at some of the causes of or predisposing factor to the subject of mental crisis. Because in a number of occasions, like earlier said, we see it from the psychiatric viewpoint or somebody that is mad. Okay, that could be said to be organic. Organic in the sense that somebody, something went wrong and the person started misbehaving, irrespective of whatever they may have done, be it drug or whatever, or be it genetic. Or that particular aspect is not our subject of today. Because we don't have such a population of people mad in the society. A large population of people are good. They look okay outside, but right at home, while alone, they are shedding tears. They are in pain, but he's dressed well, he's riding a big car. If people are even envying to be like him or her, but to himself he know that if these people know what I'm passing through, they will never pray to be me. And that's the angle we need to be in position to look at it. And the factors that could cause an imbalance in your health and also in your mental state center to be from the angle of the diseased body. Hear this. I've told us over and over again what propels everything you dream in life. Your prosperity, your anointing, your whatever you think you are, is the well-being of this body. A sick person is mentally imbalanced. No sick person is happy. Not one. And come to think about it and why you should give attention. Fundamentally, let every other thing, economy is not good, this is not good, but let this your body be healthy. He said, as many that are joined with the living, there is hope, not the dead ones. Now, you come to think about a man who has been hustling, breadwinner of his family, taking certain responsibility. He has a vision, he has an ambition, he has an aspiration, he has all this and he's working hard towards that. And this person, by reason or negligence of issue of diabetes or heart-related problem or hypertension, all of a sudden this man one day, either at home or in a working place or somewhere, all of a sudden, and the person fell and said that he has stroke. Now listen to this. And I will tell you why most of the stroke patients, they die, not necessarily sometimes because of the disease, but because of depression. Where is the depression coming from? A man who used to take care of his home, and all of a sudden, that same man just got broken to the point that the man that used to be very active is now drawing a... Come on! It will not be a portion. That should be the right word. If he knew what it takes, that a man who used to take care of his family is suddenly not able to do the same, not able to be, if we know the reason why you should take care of that your health first. And woe unto such man if he has gone from the level whereby he has now become a liability to his family, and worse still, to be fed by his wife. Oh, goodness me. I'm here to say it's good that a woman cares. It's good that a woman cares, maybe cares, but as a man, husband, don't depend on their wife. It is a mental crisis already molded and waiting to burst. It is not something a man should depend on because you will eat. Let me tell you, the hormonal combination in a man gives him the capacity for people to eat from him and he will not complain. In a woman's genetic makeup, it is not meant for them to be, but everybody will eat from them and they will be happy. No. No. Your own is our own. But their own, as a man, listen to this, your own is our own. But their own is their own. It's not meant for me and you. And you can't depend on it. Even God is saying you shouldn't depend. All right? So find a man in that state who used to take care of the family, big ambition and vision. All of a sudden he's down because of the issue of stroke. Issue of heart-related problem. He can't walk again. He walk a little. He gets tired. Yeah, and all of a sudden, he sees himself becoming dependent. You know what? Sometimes suicide may be even attractive. For the reason I'm speaking, that we need to come out from the issue of depression by first of all taking care of your health. Health-wise is quite important because I've also told you today, a man can be emotionally unstable, very unstable. When you see a man that has a problem of weak erection, you know, I've told this over and over again, people don't tend to understand. A man that has weak erection could be in position to acquire humility that is not his. You see the man so sometimes depressed, sometimes withdrawn, sometimes not finding interest in things that used to make him happy. That is a sign of depression. Classical sign of depression. At the point the man will come to a point where if you offend his wife, he will say sorry. And if his wife will face him, now he again go tell the woman, sorry now, what are we talking about here? Yeah, I'm forgiving you. Whereas she's the one that is offended. Because of what? The problem of weak erection sometimes entails people to such mental crisis. For that reason, you should be able to have attention of sex therapists to be able to come out of such a condition. Now, looking at our society, traditionally, quite unlike what is obtainable over there in the United States and also Europe, where people get married, issue of childbearing not like do or die affair. But regrettably, in this side of the world, you see somebody married and have a child, the entire family, everybody will be after this woman as though if you don't born, you are gone. There are people today, just because of the issue of childbearing, they are in emotional disaster. Each time they see other people with their baby, they start crying. They are sleeping, they are still crying. You could see them wearing nice clothes outside. And that's why I want to encourage every woman. Listen to this. Every couple, start early to look out for solution to your problem. Very important. Jesus said, I will work when it is day. Lest night comes when no man will be able to work. I will tell you this. There is a period, they call it reproductive period of a woman. And within this reproductive period, it's expected that you take maximum advantage of that time. Give an account of it. You can't get married. You don't know whether you have low fallopian tubes. You don't know whether you have low sperm count. And you will stay in that condition 5 years, 10 years. From there, you will not be able to achieve pregnancy naturally again. Sometimes money may not even be there for you to go for IVF. Why not you start early? At least get to know what is the fundamental problem you have. By so doing, you could be able to seek the way out as early as possible. If they say from the day when you people got married, there is a challenge. Nothing is yet. Life has never been without challenges. You'll be able to, even if we can't do it then, you buy time to attend to it. But when you have wasted the time moving up and down, before you know it, marriage that has been so beautiful, companionship as it were, will now begin to have all manner of things planted inside. It is important you start early. Don't waste your time. Most of our women don't also get married on time these days. But whatever the time, start to do the right thing as quickly as possible. Stay tuned when I come back. We are now going to look at certain deeper dimension issue of socio-economic status. We will look at why today many people are on drugs, antidepressant, and some people, as I'm talking to you now, is nurturing possibility of committing suicide. Today, I will tell you, if you're thinking of committing suicide, I will tell you the fastest way to avoid the issue of suicide. And you know what? As a woman in this segment, I will reveal to you the latest strategy of divorce that has rampaging our society today. Watch out for it and save your loved ones. Stay tuned. I'll be right back.
My name is Dr. Damian Chiagromo Parocha. I am a surgeon, a consultant surgeon that works in Federal Medical Center over Imo State. I want to thank God especially because I had a heart attack, and this happened in my house around 5 a.m. I actually had sudden heaviness of the heart, chest pain, and began to lose breath. I couldn't breathe again, and suddenly I collapsed. I want to especially use this opportunity to thank my wife for acting promptly to save my life. Again, I want to thank the medical director of Federal Medical Center, where Dr. Kingsley Achibu. He actually arranged for my being taken to Port Harcourt. The major treatment happened in Port Harcourt in Save a Life Mission Hospital. Before I reached there, Dr. Richard Okoye got to know about it, connected the interventional cardiologist, and everything was waiting before my arrival. So as we arrived there, I was taken straight to the cath lab. The cath lab is where the cardiac angiography was done. And from there, they also did the cardiac intervention by passing a stent. And that's why I'm alive today.
Welcome back. You are still on You and Your Health. And today we are discussing something very emotional. And something that is a little bit what they call behind the scene. That why you see people look, oh goodness me, I want to be like this person, you better be who you are. Because what people pass through in their closets, if you get to know, you will not be in position to seek to become.
You and Your Health with Dr. Richard Okoye.
One other factor also is laziness. Laziness breeds depression. When you are not working, you are bound to be depressed. You are bound to be frustrated. Anxiety is bound to be there. I observed something very striking, that I discovered that the people that are in Nigeria who will say that to be doing nothing, and I don't have job, and that's why I'm not working. We travel abroad, and you see same person doing 3-4 jobs to make ends meet, and you know what? Most of those jobs that are doing over there, they can't try it here in Nigeria. They will feel as if it is one useless job, not up to my standard. And that's why laziness has become our character, because we have free food in this country. But see, hear this. It is important that you work. Work is a way out of depression. Working is a means of distracting that very thing that tends to weigh you down. One of the presidential aspirants made a statement that I feel that other presidential aspirants should also acquire it as a solution to our problem. Moving people from consumption, I beg, help me. Can you just give me dough? Free contract. Moving them from that state to the state of work, which you'll be able to become productive. When you become productive for yourself, you discover that the issue of depression, anxiety will eventually be weighing gradually until God puts you in that place that you have desired.
You and your health with Dr. Richard Okoye.
There's a trend I want to bring to everybody's attention now. And it is a strategy I may even see that some people are taking advantage of it, even to divorce their wives. You see a scenario where married people, even with children, reason they will give you Nigeria is tough. Where on earth is not tough? Take it from me. Where on earth? I challenge you. Ask those people that have run out of the country in the past 10 years. If they actually doing well, check out what they have done for their own people here in Nigeria. It's also tough everywhere. However, the man we said, hey, babe, you people need to travel. And you need to go to Canada. You see, some of them will now start going to hospital to learn either how to be a nurse and all those kind of stuff and all that. And this very marriage that have been, by the grace of God, held together. Even when the man will be in that state of, oh Lord, if it is thy way, let this cup pass over me. And now the door is open. And that very door is ordained to ask the children, the woman and the children, to move over there. One of the things you need to watch out for, you will get sweet tongue. Sweet voice, don't worry. You people should be up there. You know, I will be going and coming. I will be going and coming. So, if he has the money to be in position to go over there and come, what stops him from taking care of you people here? That's a very big question. I'm not undermining marriages that has been formed on distant relationship and all that. There's no issue if it has been a pattern. But because it has become a trend in the recent time, you need to shine your eyes. When the woman will be over there, maybe whether it's happening or not, she will hear one stupid story. She will now start suffering emotional crisis over there. Over there, honestly, you may not have anybody to encourage you in the midst of challenges. In the midst of challenges as you can obtain in this side of the world, where you have your loved one there to say, don't worry, we will see to that. Over there, you will see only people that are going to work. And that is one fundamental thing you will look out for. My friend, as a woman, I want to encourage you. If you are to travel, and you see this scenario, you better develop a pomo. Let your heart have enough pomo to say, to hell with whatever could be the worst, because you must prepare for it. If you don't prepare for it, mental crisis is bound to happen, as is happening to so many over there right now in their marriages and all that. Running out of the country is not a bad idea. However, you must know where you are going. Can a man begin to build a house without sitting down to count the cost? Let him start running and stop on the way. It becomes a mockery. Many people are today on drugs to sleep, on drugs to be able just to maintain certain level of stability, my friend, you can come out of it. Stay tuned. When I come back, I will give you just one tonic, and that tonic is tonic to avoid suicide. You want to commit suicide? Just one tonic I will give you, and that will solve all those your problems. Stay tuned. I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. Today we are looking at behind the scene, emotional, depression everywhere, people having suicide tendencies. But are you thinking of committing suicide? You are thinking you are depressed, you want to commit suicide. Let me give you one tonic. If you drink it now, it will be over. All right? If you want to commit suicide, the only way and the fastest way to avoid it is for you to try it. Just try them first. Once you try them, you will understand what I mean, that is the fastest means for you to avoid suicide. There happened to be a man 1 year back in my village. This man happened to think of the worst has happened, that he can't bear it anymore. He decided to commit suicide. Only for him to enter the bush, climb one tree there, and hang the rope. As he jumped down, the guy struggled as he was about to die. Fortunately for him, the rope cut into two. He fell and momentarily lost consciousness. When he eventually opened his eyes, the man took off. He took off back to the house. So when he ran to the road, some people saw him running and joined him because they don't understand what was actually pursuing with the half of the rope on his neck. And he goes to his house, and they now rose to him and say, now what is the problem? He said, my brother, if I can't tell you what my eyes saw. My brother, they said, what's the problem? Why this? Why this? He said, my brother, if I tell you what my eyes saw, my friend, just try and first make your eyes see something so that it go clear. You know, a madman said, I won't tell anybody when you use machete to work out for my back. Until I look for my head, I won't see. That one I will get clear picture to be able to talk to them. But most importantly, let me tell you, if you are preparing to commit suicide, hear this, because you don't know where they go. I will tell you. If you are planning to commit suicide, maybe in God's agenda, you are meant to live for 80 years. And at the age of 40, you decided to commit suicide and take your life. You know what? You know they go anywhere. You go waka. In the remaining 40 years for you, your spirit go dey waka everywhere. You no go get rest. That's why he say when the spirit is cast out of your mind, look for places to rest. If you no find, you go begin. So you go dey find. And of course, you know the situation in the country now. Uncompleted building, no day. The one they don't occupy them. So you go to waka for road until the remaining days of your life. There's no room for that. We're going to continue on this series as we will talk about coming out of what we may call to be the dead end. Nothing is working again, disappointment, and all this. We are going to find the best way out of it, because as many that are joined with the living, there is hope. See you again next week as we continue this series.